to the Pink Ribbon Roller Coaster. We're so glad you guys are joining us. As always, we have a special guest joining us today. She is a dear friend of Project 31. Her name is Lindsey Jackson, and she is a certified oncology nurse, and she works in the SSM institution. She helps us with our support group that we lead here in Oklahoma City, and we've asked her to come on, and we're going to do a series of sessions with Lindsey. She actually teaches a Chemo 101 class there for all the patients at SSM. And so she's going to come on and she's going to teach us as well. So welcome, Lindsey. We're so glad you're joining us.
Thank you. Thank you so much for having me.
So tell me a little bit more. I know that you have all these credentials and I wasn't sure exactly how to introduce you. So help me understand a little bit more of what kind of credentials you have as an oncology nurse.
So I have currently my associate degree in oncology. I'm working on my bachelor's. I am a member of the AONN, which is a national group trying to stay up to date on oncology. And I'm certified with my chemo bio for infusion, oncology infusion.
Awesome. And I know that you are such a blessing to so many at SSM, and I'm so grateful for you. Guys, she's very intentional with her patients and very compassionate, and she's been an ambassador for Project 31 for quite a while now. So today we are going to focus on CBCs and the effects that chemo can have on your labs. So let's start off with our first question. Can you just explain what a CBC is and why it's important during chemotherapy?
Absolutely. So I'm sure everyone tuning in has had one or multiple CBCs drawn at this point, also known as a complete blood count. That is how we track how safe it is to proceed with your treatment. So our patients typically have a CBC drawn before every treatment. And we look at 4 labs in particular. So we look at your white blood cells, your WBCs, which are the cells that fight off your infections. If those get too low, you don't have an immune system. That's where you get words like neutropenia or immunocompromised, which is a big concern for people going through treatment. Then your hemoglobin and hematocrit, which are your red blood cells. Those are the cells that take nutrients to your tissues. If those get low, you may have heard of anemia or been anemic. That's where that comes into play. And then your platelets are the cells that clot your blood. So if those get too low, we're looking at higher risk for bleeding, which can be an emergency. And so your physicians are always looking at those ranges to make sure that proceeding with chemotherapy is safe to do, because safety is always number one.
Right. Okay. So as you come in, especially for those of you who maybe haven't started chemo yet, this is really important for you guys just to have an understanding of the process and why they do it the way they do. So tell me, what do the white blood cells tell us about a patient's immune system during treatment?
Great question. So a normal white blood count is from 4.8 to 10.8 thousand. So it's a big range. And your physicians will, everyone's different. And so they're going to base kind of their safety parameters on what's normal for you and your treatment. Some treatments have a higher risk of knocking those down than others, and they'll discuss that with you. But if your white count gets too low, you have no way to mount any kind of defense against infection. Okay. So that can be very serious. You don't have any kind of white blood cells, and you get some kind of infection, you can get very sick very quickly.
Mm-hmm. So it's, again, like you just said, it's for our safety.
Yes.
And I think that's a really good point that you made, that there's a range, that everybody's different, because I think sometimes as patients we talk about, well, mine's this, mine's that. And I think that is important to note that everybody has a different range, but then also knowing that everybody has different protocols too, and how your body responds is going to be different as well. So that's a good point to make.
Absolutely. Like with our electronic health record, with my chart, you have those little green boxes or red boxes depending, and that kind of freaks people out. So like, well, I'm in the red box. Well, that doesn't mean you're unsafe. That just means that per their range in this particular instance, it's a little off. So
okay. Now, how do the low red blood cell counts affect how someone feels on the day-to-day?
The red blood cell counts or the white blood cell counts?
The low red blood cells.
Low red blood cells. So if your red blood cells get low, you are probably really fatigued. You might have some shortness of breath. And that, people think, well, outrunning, like pushing a cart through Walmart, you just might get winded. There may be some dizziness, especially when you get up in the mornings, because we're also a little dehydrated. So if you notice any dizziness in the mornings, sit on the side of your bed for a minute. Don't just pop up out of bed. But these are all things you also want to report to your physician. If you already deal with shortness of breath. It can worsen your shortness of breath.
Mm.
Um, and so that's something I'll let your doctor know about.
So is that kind of in the anemia range? And okay, now what else can we do to help that? Hydration, is that help, or should we just
Hydration is huge. Nutrition is huge. You want to make sure you're getting enough protein in
okay?
your diet. I kind of give my patients the guidelines of you want to aim for 1 gram of protein per kilogram of body weight. So an easy way to figure that is whatever you weigh, just cut that in half. So you're a 200-pound person, you're looking at 100. That's the amount of grams of protein you want to aim for in a day, which is a lot. That's a ton.
Yeah,
Most of us don't get anywhere close to that. So you just really want to focus on increasing your protein. So I
okay.
encourage, especially on the days you just don't feel like eating, your appetite's low, have some kind of protein supplement on hand at the
Hmm.
house. And everyone's like, well, what's the best kind of protein? What's the one you're going to consume? So
Yeah,
if it's something that doesn't taste good but it's high in protein, it's pointless because you're not going to eat or drink it. So just
yeah.
finding one. There's so many out there on the market. One is not better than the other. Just have in mind when you do protein supplements, the ones with the higher protein content tend to give GI issues. So things like bloating, constipation, diarrhea.
Mm-hmm.
Carnation Instant Breakfast makes one. It's in the cereal aisle. It's 15 grams of protein. You mix it with milk. It literally tastes like chocolate milk.
Mm-hmm.
So
I've
yeah,
had that. It's good.
yeah, it is really good. And then movement. So physical activity will help with that fatigue. It's counterintuitive because you're like, well, I'm tired. I need to go sleep. But the fatigue from anemia, just getting out, even like walking down to your mailbox and back or doing a lap around the block can really help fight that.
Okay. So I want to wrap back to the if we do have low white blood cells, what do they do to help build that? Or does it just build back on its own?
Great question. Some chemotherapy regimens will automatically come with a growth factor injection that'll be at some point in your treatment, usually like on the second or third day.
Mhm.
And that because some of them we just have know from evidence that they just knock out your red blood cells. So you may get that. Others, if we just give your body about a 7 to 10 day break, your bone marrow will regenerate itself. Your body's an amazing, amazing thing. So if your white cells get too low, your doctor might just say, hey, we're going to hold off treatment for this week. Come back in a week. We're going to redraw labs. Magically, your labs will be better, and then they can proceed with treatment. So don't get disheartened if that happens and know that it's pretty common.
And I like the point that you made too that there are some medications that obviously you know that certain chemotherapy drugs are going to deplete the white blood cells. So when ladies hear, well, I got this, well, I got that. Well, if you're not taking that chemotherapy, you're not going to have that option. So I think that that's an important note because it doesn't apply to everyone.
Right.
So,
Everyone's regimen is different, and insurance is different. So some
mm,
insurance will give us the medications right off the bat. Some insurances make us prove that this is in fact going to happen. So you might not get it with your first round, but if your counts drop, then maybe we can request it and you might get it with subsequent rounds of treatment.
okay. So what does that look like? Because I know some ladies have like a little thing that it stays on them and they go
Uh-huh.
home and then some come back for shots. Like, can you explain that a little bit?
Yes. So once again, it's usually facility and insurance dependent. So they're called an on-body injector, and it's a little device that we place on you here. You'll go home. We have to time the injection for a certain amount of hours after the end of your treatment. And so
Hmm.
if you live far away, or if it's over the weekend, we may be able to put that on you. You'll go home. It'll go off on its own when it's time to do that. If
Okay.
you're coming back to the facility to get your injection, we'll time it as well with your schedule, and you'll just come in and you'll get that injection. There has been research that has shown taking 30 milligrams of Pepsid and 10 milligrams of Claritin the day before an injection, the day of an injection, and for up to 5 days after helps because you've got to think we're forcing your bones to make more cells. That's painful,
Mm-hmm.
especially in like your hips, your joints, those kind of bigger bones, your shoulders.
Hmm.
And so the Claritin and Pepsid can really help with that bone pain. So if
Okay.
that's appropriate for you, that's something either your physician or your nurse will discuss with you before you get that injection.
That's good to know. I didn't realize that about the Claritin and the Pepsid. That's good to know
Yeah,
because
they're histamine blockers, so they just kind of, for whatever reason, help with that pain.
well, I know a lot of ladies that talk about that, and it is hard. It's very hard for them to try to because your body's trying, but you're still having these side effects. So that's at least you have some option. Okay, talk to me about what role do the platelets play, and what symptoms might show up when they're low.
Sure. So platelets are the cells that clot our blood A range for those is anywhere from 130 to 400. So once again, there's a big difference. Everyone's different. If they get too low, you're at a higher risk for bleeding. And so that would be potentially a point where your doctor would hold your treatment to let your body rebound. Symptoms of low platelets, some of us bruise really easy anyway. And so
Mhm.
that is a symptom of low platelets. So if you notice lots of bruising, especially when you don't remember any kind of injury, that's a
Mhm.
sign your platelets might be low. Little red kind of spots, little pinpoints, like petechiae, that's a
Yeah.
sign. Bleeding when you brush your teeth, sometimes that can just be resolved with like a soft bristle toothbrush. But if you
Yeah.
know profuse bleeding, that's low platelets. Bleeding from anywhere is a sign of low platelet.
So what do you do? Like, do you just let your body like replenish itself, or are we supposed to do something to try to help rebuild the platelets?
So your body, once again, will be able to replenish itself. We just have to protect ourselves while they're low. So you want to avoid activities that cause injury. So like
Okay.
playing sports, even like pickleball, where you might fall and scrape something where you have a bleeding risk.
Hmm.
You want to avoid any products like ibuprofen, aspirin, Advil, Aleve. Those are called NSAIDs. Those increase your risk for bleeding, and so we want to avoid those while your platelets are low. Take something like Tylenol. Um, you want to make sure, if you're knitting or gardening, anything where you might cut yourself, that are using protective gloves. Um, even, climbing a ladder to hang a picture where you might fall, anything like that. The most important thing that we tell our patients that is an emergency, and in all my years of doing this, I've never seen it. But if any point during treatment you have a sudden, severe onset of a headache with a vision change, that is a 911 phone call because that can indicate a bleed on your brain, and that is an emergency.
Okay.
Like I said, I've never ever seen it, but I do like all of my patients and their families to be aware that that is an emergency situation.
Okay.
So yeah, just avoiding injury, avoiding bleeding, and then reporting any bleeding. Anytime you're bleeding and you're holding pressure for more than 10 minutes, your physician needs to know.
Okay. Okay. So how often are blood counts checked during chemo, and what happens if the numbers are out of range?
So with our patients, they are checked prior to every single treatment. And then if our patients call with any kind of concern, like if they called with a bleeding concern or fatigue concern, we check blood counts at that point as well. And
Okay.
then if your counts come back with any abnormality or an unsafe range, then we give you that direction, like, with the white blood cells, the things you need to do to avoid infection, or the red blood cells, and we'll
Hmm.
direct you at that point.
Okay. And then what can patients do or avoid doing when their counts are low?
So if your white blood cells are low, the most important thing to remember is you've got to protect yourself from germs and infection. So with the white cells, you want to avoid crowds. If you do have to go out and you feel comfortable masking, we really encourage that.
Hmm.
If at any point during treatment you start running a fever and our guidelines are 100.5 or above, your physician has to know. That
Okay.
is that is an emergency call to your physician. You want to always stay away from people that you know are sick. If you are neutropenic or having low white blood counts, you want to avoid things like sushi or raw meat where there might be bacteria in there. You want to
Uh,
avoid sources of stagnant water. So if you use a CPAP or a humidifier, you want to make sure those reservoirs are cleaned regularly. If you use anything like a denture cup or something for braces or retainers, you've got to make sure you're diligent about cleanliness there.
okay.
If your white counts are low, also no, you can't have any contact with animal waste. So you're cleaning up after the cats, the dogs, fish tanks, your bird cages, all of that come with risk of infection with a normal immune system you don't have to worry about. And then just, good hygiene otherwise. So washing your hands after you use the bathroom, before you eat, washing your fruits and vegetables very thoroughly, and then reporting any signs of infection to your physician. So you start coughing up green or yellow, or we think you might have pneumonia or an upper respiratory infection, your doctor needs to know. In our clinic, we can treat you for those types of things, test you and treat you for those, so that
Okay.
you're able to stay on treatment. We want to keep you out of the ER. We want to keep you out of the hospital. And then big thing too are signs of UTI. So burning during urination, you're going to the bathroom more than normal, which for the first couple of days after treatment is normal because we're giving you so many fluids. But if that continues, or feeling like you're not emptying your bladder, any blood in your urine, your physician needs to know about.
Okay. Wow. Now, what causes, I know this is a random question, but why is UTI prominent? Because I feel like a lot of people do get UTIs.
That is a great question. Um, and I don't know the answer to that. I know with us as women, we're kind of, our anatomy is against us. So
Hmm.
our urethra is really close to our rectum, and there's just a lot of breeding ground for bacteria.
Bacteria.
Plus, when you're fatigued, you're probably not drinking enough water. You're probably
Mm-hmm.
not getting up and maybe going to the bathroom as often as you need to because you're just like, I just can't even get up and walk over there.
Yeah.
you know
Yeah.
so we just and chemotherapy, while it does kill the cancer cells, it messes with all of our good bacteria and our good cells as well. So we kind
Hmm.
of we get rid of all that good vaginal bacteria, and our vaginas get very dry as well, which is higher incidence for UTI. So I think it's
Mm.
multi-purpose, a lot of things working against us. Yeah.
Makes sense. Okay, well, guys, I hope you guys have enjoyed this session today. Lindsay, thank you so
Thank
much.
you
I'm
so
really
much.
grateful for you to be willing to educate us. So next time we're going to talk about hair loss because I know a lot of women, especially in the breast cancer arena, the chemo drugs that we take do cause hair loss. Not all of them, but a majority of them do. So that's what we'll talk about next time. So we can't wait to see you again, Lindsay. Thanks for
Looking
joining
forward
us.
to it. I hope you have a wonderful day.